well and you're coming from a personal place, it might be a little easier to say it versus you're just out trimming your hedges and there they are. And do I say anything? And I wave, but they didn't see me and now it's awkward.
You
So
give the generic answer to your neighbor, or like you said, how well do you know them, or do you give them a more in-depth answer?
yeah, exactly. Exactly.
Or do you even know that they're part of like a nurse and can help you, or
Mm,
you know.
thank you. Yeah, Audra. I think it's just important to understand that regardless, we can understand that we can use ourselves as a resource too, right? Some of us have a lot of extensive knowledge in this area, while some of us aren't. But either way, we could still say, oh, hey, as I mentioned to Brooke, my cousin, she really struggled with postpartum. Have you noticed anything different? And that could be from a place of, I personally don't know what that feels like, and I'm not an expert in it, but I heard about it from my cousin, and so I'm curious. And so just that little inkling of interest could bring an idea to that mom, and she could think, oh, I have been feeling different. Or even the father, as you guys said, you don't know where the father's coming from. So asking him, have you noticed any excitement from you on the baby coming? How do you feel? And stuff like that. Because as we also mentioned in our breakout room, men a lot of times aren't allowed to feel about things, right? They're not allowed to show emotion on stuff. A lot of times, especially with kiddos, it's like, okay, you had a baby, get back to work, as Brooke said. And so that is a wonderful way to understand that regardless of how awkward it might feel, how little we may know someone, we can still use ourselves and our own knowledge, our awareness of what's available in the community and share that. Of course, to a responsible level, you're not going to come to someone and say, you need to go to parenting classes. That's that piece that I was talking about earlier that's not going to bode over well. But just giving yourself a little bit of space to make yourself feel as if someone can come to you. Approachable is what I'm looking for.
Well, I actually had postpartum pretty bad with two of my children, and the father of my children, like, he didn't even really notice it too much, because I hate to say it, like, you're so emotional when you're pregnant
Mm,
and you're already not yourself. And so your relationship, even like just, spouse wise, is not normal.
yeah.
And you're already more agitated and off and everything else. And then, like, because you had a lack of sleep there at the end too, because you're going pee every hour on the hour. And then when the baby comes, both y'all are kind of on edge because of lack of sleep and just extra stress of having a newborn child to take care of and, be responsible for. A lot of the postpartum stuff kind of does get swept under the rug. You don't really, I wasn't even aware of it
Mhm.
really until I went for like my 6-week checkup, actually. And Aaron started asking me questions that kind of made me more aware, and I was experiencing it and had no idea. And he really had no idea, because he just chucked it up to, oh, she's just still emotional and still kind of edgy, and or the crying, or it's everything, because you're just emotions are all out of whack anyway.
Yes. Absolutely. And that's what I love, though, is that at your checkup, it was able to be brought to your attention. Um, Hopefully we could get it a little bit earlier in there, maybe when you have your ultrasound or something. But that is the idea of prevention, is trying to get that awareness out there early on. That way we can negate any super bad symptoms or
I agree, because if I would have known what, like, the questions they asked me, the more things to look for, I would have been more aware. And I just, it just, like you said, you don't really think about it. You just, oh, I'm just tired and my hormones are so out of whack. You don't really think it's depression, you know?
yeah.
And it can also happen much later on. It doesn't happen always right away after you have a baby. It
Yeah.
can be 6 months out. So I
True.
think that's important too, to make sure that women understand, and men as well, that it's not just, well, you had a baby automatically. That's the only time you're susceptible to it, because it can happen technically up to a year postpartum.
Yes, thank you for that, Kate. That's a very good point. And that kind of brings me to the point of, I love our example with the postpartum piece, but overall prevention can be found in anything, right? It can be used in mental health, it can be used in behavioral health overall, or it can be specific things like civic engagement or drug use, things like that. And so this is really a concept that you guys can use in any area. And that's really the main point of today, is just going over what supporting families with prevention could look like. And so Chad, on that, I will have you go ahead and hit next. I see we have 4 minutes left. So technically I have this activity for you to do prevention on your own, but because we are running a little late on time, I'm going to just have, if you want to, I will leave it on the screen for just a minute. Essentially, it is just coming up with your own situation that you've either currently or previously have dealt with, pinpointing a risk factor, a protective factor, and then we won't have time to share, unfortunately, but just trying to put into action those steps that we learned, which was awareness, education, and guidance, and how that could work in your own situation. And so Chad, next, please. Perfect. So what did we just learn? What did we just go over? Let's kind of summarize what we learned here. Next. So we learned what family dynamics are, the processes that make this dynamic up and how they affect our development even. We define risk factors, protective factors, and then we learned how to identify them in particular situations. And then we learned what prevention is literally defined as well as how to break it up into actionable steps. Again, those actionable steps are going to be awareness, education, and guidance. And then finally, we used real life examples to be able to implement them, right? That scenario with the expecting family was a great example, but again, this can be used in so many different walks of life and areas of life. And so I will end this session of supporting families through prevention by just leaving an opening, for any questions or comments. Chad, if you'll hit next, they will be able to see my sources and resources available as well, if they are helpful to anyone. I will be silent for 1 moment and then I will close out. And let me see if I can see the chat too.
Was this taped? Because I had to leave momentarily, so I missed out on some of the slides.
Yes, actually, yes, we did record and we will have that available for anyone.
Great, thank you. And how do I get that?
I will let Chad answer that.
Yeah, I will email them out to everybody that attended today.
Perfect. Well, thank you, everyone. I really hope this was helpful in understanding prevention. We look forward to just broadening and going deeper into what prevention can look like, especially with the rest of our team's wonderful presentations. Next week, Wednesday at 11 a.m. on the 14th, we have Mr. Chad Child's presentation, which is going to be tools, right? Prevention tools for families. And so I am excited to see you all there. I really appreciate you all coming. If you have any questions, please feel free to contact me or Chad. I would love to answer a question or a comment if you had any. And I will leave it at that. Thank you all so much for coming and supporting us.